for this life, and we patients who have
this morning, representatives from the World Health Organizations, representatives from the other partners in this battle against TB, everybody who has been part of this fight to battle TB in our country, those who have been survived, those who have survived it and continue to move on. Ladies and gentlemen, I am happy, as I said before, to be part of you, to be here today in the celebration of this very important date in our World Health calendar. At the outset, this event should remind and continue to encourage all stakeholders to work even harder to reach the targets in terms of case detection and cure rates that we have set for the nation in relation to the WHO set goals. At the outset too, I'd like to acknowledge the financial assistance of the Global Fund to fight HIV, AIDS, TB and malaria, and the technical assistance from the World Health Organization. Under the Global Fund grant and technical assistance of WHO in partnership with the Ministry of Health, we hope to significantly reduce the burden of TB and mortality in Fiji. And this can only be possible by ensuring increased detection and high quality directly observed treatment. There is a need also to empower people in the communities to actively participate in TB control activities. Compared to 2012, which had 218 TB cases, last year we had 385 TB cases. When I saw this figure, I was a bit worried. But then I saw the next statement. It says, this shows the increase in cases is attributed mainly to the commitment of the Ministry of Health and Medical Services to improve TB control services in all divisions in Fiji. And perhaps this shows our stronger emphasis on trying to identify where these cases are. The National TB Program is expected to detect more cases through its new initiative by actively screening high-risk groups and improving access to screening in the hard-to-reach areas nationwide. The World TB Day, March 24th, commemorates the date in 1882 when Dr. Robert Koch announced his discovery of the cause of TB, a remarkable achievement that paved the way towards diagnosing and curing this dreaded infectious disease. Today, and I'm sure most of you already know this, TB still claims approximately 1.5 million lives every year, posing a significant health risk to poor and malnourished people living in developing countries. About 5,000 people die worldwide each and every day because of TB. That's a big number. Reach the 3 million, reach, treat, cure everyone is the theme for World Tuberculosis Day this year. This theme continues to remind us of the commitment required by all stakeholders to consolidate our efforts to prevent and control TB. The Ministry remains firmly committed to TB control and will continue working with partners to improve access to quality diagnosis and treatment of the disease. To address TB, there is a need to further improve processes in the health system and engage communities to be committed to the fight against TB. We therefore need communities, TB survivors, and civil society to drive this endeavor, not just government alone, everybody working in partnership. To sustain the fight, there is need for political engagement and financial support from donor partners. This World TB Day 2015 will signal a renewed effort to alert the national TB emergency, emphasizing the unacceptable situation that many cases of TB go undiagnosed, untreated, or are not cured. And we hope to be able to address that. The Ministry, through the National TB Program, is building community capacity to play key roles in detection and treatment activities. TB is spread through the air when people who have the disease cough, sneeze, or spit carelessly. It is important to seek treatment quickly when you realize that you have TB symptoms. TB symptoms include a cough that does not go away for more than 2 weeks, unexplained loss of weight, fever, and night sweats. TB is not just a public health challenge, but also a development problem. This devastating disease strikes people during their most economically productive years. TB takes an enormous personal toll and places a tremendous economic burden on families, communities, and countries. Treating and curing TB at first attempt is important because it prevents the spread of TB, improves productivity, and averts TB death among workers, thereby increasing community productivity. TB is the most common opportunistic infection and the most frequent cause of death of people living with HIV. People with TB and HIV face similar problems of stigmatization, fear and discrimination, and have common needs for care and social support. TB and HIV fuel each other in conditions of poverty, underdevelopment, overcrowding, and poor nutrition. We therefore need a comprehensive package to improve the social determinants for better TB, HIV prevention, care, and support, and that is something that government is emphasizing right now in terms of supply of water, housing, and other areas that we're trying to put in place. The Ministry of Health is committed in its vision to improve access to health services to all the citizens of this country and therefore improving access to TB care. The Ministry cannot win the fight against TB single-handed. It needs partnership, it needs everybody working hand in hand. We need to build partnerships with all the various sectors of society. This will assist in consolidating our resources for effective TB control interventions. Our 3 TB centers in the Central Division, the PJ Twomey Hospital, in the West, the Lotoko Hospital, and in the North, the Lambasa Hospital, provide free diagnosis and treatment to the people of Fiji. TB is curable and preventable. I think that's a key message for us. It is curable and preventable. And to make it really happen is something that we all must work together on, making sure that it is curable, that we cure it and we prevent it from happening. If you have been diagnosed of TB, it is very, very important to complete your full course of treatment. Because if you don't, it's not going to go away, and it could make the TB even worse. Let's stop TB now. Even though a cure has existed for more than half a century, TB remains one of humankind's greatest scourges. As we commemorate World TB Day, let's remember that the battle is far from over. Together, let's make Fiji TB-free a reality. And in closing, I'd like to thank everybody that's organized this function. I think it's very important to make sure that there's awareness of all the activities that we're doing. So for everybody that's organized this function, I'm glad to see that you're all here. The vision of government is very clear. Our vision is basically to create a better Fiji, which means a better Fiji for everybody in this country, for those that have disease, those that do not have disease. And it's something that we realize that no government can achieve on its own. It is something that has to come from the cumulative effort of everybody involved. And I think in this particular exercise that you've been involved in TB over the past few years, it's a good reflection of how we can work in partnership to try to address something that's impacting on the lives of our people. And as we mentioned before here, the TB is actually impacting on people who are in their most productive years of their life. So if we're able to address it, it also has an impact on the amount of wealth that we can create in this country. So I thank everybody that's been involved. I think the message out there is very clear. It's to make sure that we can go out and reach everybody, which requires a total commitment from different parties to treat everybody and to cure everybody. And that's an approach that I'm taking up in the Ministry of Health, not just in TB, but in other areas. We hope to work with our religious organizations. We're going to be reaching out to all of them so that we can take this message on the various aspects to do with health, to go out to work with our religious partners, all the different religions, so we can take this message across to them and we can impact people in society. So today is all about TB. We hope that this is just it's not the end of a journey, it's just one step in a continuous journey as we move to make sure that we can achieve what is written on that slogan. TB is curable and together we can beat it. Thank you very much.